really been great. Now, speaking of which, as you were saying about your role at UW, and this is something that I had no idea about really until I got my postdoc here at Central Washington Family Medicine about this role of being a behavioral scientist. I think, and you've been one of the, obviously I don't know if it's the pioneer, the word that my mind goes to is about what that role means and how to go about that. Can you talk a little bit, one, about what the behavioral scientist role is, and then why you feel it's so important to, integrated care, but even beyond that, to the development of family medicine physicians?
So, well, we've known now since the late 70s that the first place, from really good studies then, that the first place that most mental health problems present is the general medical sector, not the mental health sector. We've also known that managing chronic illness is a huge challenge from a behavioral perspective. So just thinking about the intersection of those two things, where do most mental health problems present and how hard is it to manage chronic illnesses, which contribute to 75% of our healthcare dollars, right? Which is where most of those dollars go. So integrating behavioral health and primary care has always made just logical sense, just from an epidemiologic perspective. The challenge in primary care, of course, is a manpower one, a resource one, and so it's always also made sense to me to help primary care clinicians and teams manage those broad psychological and social issues that interplay so intricately with the medical issues. And when I mean that, I don't mean just adding the role, the role of a behavioral health provider, clinician, but also helping the entire team understand how to include those skills in their day-to-day repertoire. So it's integrating not only role, but also function. So I've spent as much of my career helping doctors learn therapeutic communication skills and teams learn to function well together, medical and nursing teams learn to function well together, as I have trying to figure out how to integrate and make the best use of behavioral health clinicians in primary care. Does that make sense?
100%, Larry. And my mind has so many different follow-up questions, and I'll try to keep them. We nerd out about this stuff, about what you're just talking about. It's not about just seeing patients as far as a behavioral health provider. It's literally about helping support the healthcare system, and that's training, and that's educating, and that's working with teams. And I love the fact that you use the word teams, and not just solely providers, right? That it's MAs, it's nurses, it's front desk staff. And I don't mean to simplify this, because I think a lot of times when you try to simplify questions or simplify ideas, you don't get the greatest answers. But I am curious, if you were to train a primary care provider or a primary care staff member one thing, what would you train them?
Oh, interesting. I think what I would do is emphasize curiosity. We tend to want to too quickly go to a diagnosis and treatment and forget that the human being that we're working with has a lot of knowledge, and to understand their view of the world increases the likelihood that whatever we prescribe, whatever we choose to do with them, is more likely to be accepted if it's designed in a way to fit. So early on in my career, I confronted the term non-compliance, which is the medical literature's way of saying they're not doing what I told them to do, which completely abdicates responsibility for understanding what people's belief systems will allow and their cultures will allow and what their personal resources will allow. But that's a pretty broad, term. And I don't mean in any way to denigrate or discount the value of the incredible diagnostic and treatment capacity that Western medicine has to offer. But person-centered healthcare is very important, and I think it rests on being curious about the individual's experience.
And I love the word that you use, curious, to increase curiosity.